RESCU TV. We are here with Dr. Brooke Golden, representative from Lyric Extended Wear Hearing Aid, a product developed by Phonak, one of the world's leading developers of incredible hearing solutions. Dr. Golden, thank you so much for joining RESCU TV.
Thank you for having me.
One of the most incredible things that I learned in the information that was sent to me about the product you've developed is just how prolific hearing loss is for Australians. What are the statistics?
Well, actually, 1 in 6 Australians suffer from hearing loss.
1 in 6?
1 in 6.
And what about in this day and age where, you know, I'm certain, I might be a little bit older, but anyone younger than you know, their 30s probably has had a lifetime of earbuds in their ears, cell phones on their ears. Do you see that that's going to add to the proliferation of hearing loss in younger people?
I can foresee this. Actually, when yesterday I was at the fitness and I heard the music coming out of the earbuds. They're on these young people, and I just know that if you have your earbuds, I mean, if you have music up past 80 decibels, it's like it's a train sound or an airplane flying above.
Right, okay, so that's pretty loud. But most people love to hear their favourite song loud.
They want to feel it.
Yeah. Okay. So one of the I've seen on a couple of the programs, and you've done so many television interviews, the Lyric hearing aid that your company's developed is actually the only product that's invisible, that's internal, and can stay in, so you can leave it in when you're sleeping, you can leave it in when you're swimming. Tell me about this.
It's truly hassle-free, and that's what I like about the product the most. You can actually forget that you have a hearing aid. So we see a lot of, I'm going to say, psychological impact, especially for the younger generation.
And for women.
Well, of course, yes. I mean, we don't want attention drawn to our ears. We want attention drawn at other places.
It's so funny because there's no stigma attached to wearing glasses. Yeah. There's no stigma attached to lots of other things. But hearing aids suddenly are terribly, you know, aging in some respect.
And you know, this type of hearing aid is not for everyone. I first want to say we have at Phonak, we have a whole range of hearing products. But this hearing aid has been successful for those who aren't just ready to accept that they have a hearing loss and aren't ready to have to wear a hearing device that can be visibly seen. So with that population, and I've seen a great deal within the past few months, that they're not ready to announce to the public that they have a hearing loss. They still see it as an impediment. And unfortunately, that's what the public is still viewing it right now. But for example, I was in an office last week, and I had this young patient. She just cried. She said, for the first time, I feel normal. And to look in her eyes, and we went through hours of counseling, how you're going from being hearing impaired to hearing empowered.
And do you offer counseling as part of the procedure?
It's the audiologist, the provider.
Wow.
It's just built into our scope of practice. Of course, the patient comes first, and we want to make sure that they're ready for this.
Incredible. So in our trial, we've been going through the process. So why don't you tell us about what a consultation to actually having one fitted, what the process is with this product, because I think it's very different and
it's
very
extremely important, because this product is not for everyone. So the first step.
So who is it for? Let's just be clear on who it's for.
Yes, you go to your provider, and first they would do a hearing test, and the hearing test the hearing loss needs to fall into a mild to moderately severe range for this patient. And then we want to look and delve into the lifestyle of this patient. This product is not for those who are avid scuba divers or skydivers because of the sudden pressure change. So we look at that, and also the anatomy of the ear canal. You need to have the proper length and the width of the ear. Your past medical history, if you have chronic ear infections, you would
because
be
it is internal.
Exactly. And just be ready for 24/7 hearing. You'd be surprised. I mean, this is an added advantage for this hearing device, that 24/7 you can have it, which is great for safety. But some patients just aren't ready for 24/7 hearing, especially those with snoring husbands or wives.
I remember when I was young and I lived in a flat, and the people upstairs used to complain about the noise, and we used to yell out, "Turn up your hearing aid!"
It was funny, this one comment I had from a patient. He came in the next day and he said, "I didn't realize how noisy it was." He said,
The world.
"Between my wife and the birds chirping in the morning, they woke me up." And he said, "I'm happy for this," but he said it's just an adjustment. So it's been an amazing adventure helping to launch this product in Australia.
So let's just go back to the consultation process.
Yes.
So first you're assessed for your suitability, and how long from when you get first assessed to when you get fitted? Because I assume it's a custom product and it's a custom fitting.
Well, we don't need to make ear impressions.
Great.
It's offered in 5 different sizes, and again, it depends on the length of the ear canal and the width.
So when you're talking about comfortable, is it the hearing, or is it the physical, having something physical in your body?
It's having something in an area that has not had
like contact
anything.
lenses.
Yes.
So like when
the
you first
body,
start wearing
yes.
contact lenses, you feel
We don't know how the body is going to react. The body is saying, "Hey, this is a foreign object. It's in a place that's nothing's ever touched." So it's just a process that the body has to take, and also it depends too on the psychological part of that the patient goes through.
Now the other thing I want to ask you, which I found really interesting, is that you fit hearing aids to both ears, not to the one, so for example, if someone has got hearing loss in one ear, it doesn't matter, you're actually fitting to both ears. Is that unusual for this particular device, or is that always with hearing aids?
With hearing aids, you fit, if they had normal hearing on one side, you wouldn't fit a hearing aid.
Okay.
But if you had hearing loss in both ears, you want to make sure that you have hearing aids in both ears.
Sure.
Due to localization.
Right.
And safety.
And the other thing that I noticed is that you've got some kind of device that can kind of like a remote control for your ears, which I thought was so nifty. I loved it.
I wish I'd have brought that. It's called our Sound Link, and it's the patients are able to turn on or off the hearing device, or they can turn it up or down. So if you do have a snoring wife or husband, you can always just reach up and turn it off and just put it by your bedstand.
That's fantastic. Now, is there any kind of maintenance or care that's specific, and what happens after the 4 months?
This is what's brilliant about this. There's no removal to change batteries. There's no removal to clean, which a lot of the older population has problems with this, if you think about it.
I saw this fantastic segment on the Today Show, and the lady that you had on there was the mother of 3 young kids. She was gorgeous too.
Yes.
And I can absolutely see from her perspective, I mean, she really is representative of the rescue reader. Attractive, full and balanced life, but one thing that was really kind of holding her back. Can you tell us more about, what you were able to do with the Lyric in her life?
Well, she leads a very active lifestyle. Not only that, her husband is away a lot in business. So she came to us mainly concerned for safety for her children. She said, at night, I want to be able to hear if there's an intruder or something happening in my home for the kids'
I can relate to that. Like, you do want to be on alert.
Yes, exactly. So that's why she came to us first with Lyric, but also she said that the added benefit of her able to wear her earbuds to listen to her music while she runs has just been an extra added advantage.
So from a lifestyle perspective. And the other thing that I noticed in the interview is in the pre-things, she always wore her hair down. And she was stunning. And then in the post, she was always in a ponytail.
Yes.
And I thought, something you take for granted. You do, we're all women, and we are conscious of how we look. It's a big part of how we feel about ourselves.
Most definitely. Yesterday I had a young girl. She was in her early 20s, and she came to me for Lyric. And she said, "You know what? I have not worn my hair up in 6 years." And where she works, she goes, "I just want to be able to wear my hair up." And something like that. I mean, it's...
And not think about it.
Yes. And for people not to look at her. Now, she has worn traditional
Or to go on a date
aids,
and
yes.
kind of feel like, you can do whatever and not have to worry about, oops,
See, this is
there's
something
my
we don't
hearing
think
aid.
about, but yes, it's the case.
And let's talk about one of the key benefits of the Lyric, which is the hassle-free element.
Hassle-free. The 3 key benefits: 24/7, you can wear it, not think about it. The hassle-free part, not having to change batteries, not having to take it out to be reminded that you have hearing loss.
Yeah, who needs another thing to remember?
I know this, especially for a woman on the go.
Absolutely.
And the third is invisibility.
Fantastic. Now we are also going to do an interview with Nazrin, who road tested this product for us on behalf of Rescue. So stand by for that. But thank you so much, Dr. Golden.
Thank you
it was
for
just
having me.
an absolute pleasure to meet you, and congratulations for bringing such an amazing scientific development to Australia. We're really grateful for it.
Thank you.
Thank you.